you so much for coming in today. I believe that we're having an appointment about your potential suspected nerve damage, is that right? So it was suspected that you'd suffered a mini stroke, and they were concerned about the facial muscle tissue and whether you have lost sensitivity on your left side. Okay. How do you feel body-wise otherwise? Do you feel like there is any sort of missing strength or weakness in any of the muscles? How about your speech? How about day-to-day function? Have you experienced a stroke before? Any other cardiovascular injuries that you've experienced? Any other health medical conditions? Okay. I'll be taking some notes throughout our session today. This is just so that I can refer back to your GP to let them know our findings and see if we need to proceed at all to any treatment, okay? Can I just have your first and last name for the form? Thank you. Okay, so we said there was no other noticed weakness, but we will just quickly assess that. I'm going to do a multitude of different sensitivity tests, so notably sharp and dull, if you've heard of that before. So I'll be taking a sharp object and a dull object, and I will be assessing whether that you can differentiate between the sharp and dull sensation. We'll also be doing a mirroring technique where I will be placing the same amount of pressure in the same place on both sides of the face or the arms or the hands, and we will be testing to see if you can feel the sensation symmetrically. Okay, we'll also do a hot and cold as well, okay? Before we begin, I just want to take your vitals, okay? Just to make sure that otherwise you are healthy for this appointment today, especially with the suspected stroke, okay? Okay, so I'm going to begin by putting some gloves here. So when did we suspect that this had happened? Okay. And how have you been feeling since? Do you have a hospital stay? And how long was that? Okay. Was there anything significant that you were maybe doing that could have caused it? You know, like was there an outlying significant event? For example, you were, I don't know, going for a run, or maybe watching something that made you anxious, high stress situation, things like that. No? Okay, that's fine. It's not part of the test at all. I was just trying to be a bit nosy. Okay, if you could just lift your top up. Thank you. I'm going to have a little listen to your chest, listening to your heart and your lungs, okay? Okay, and now just taking a deep breath in and out. Very good. And again, deep breath in and out. Deep breath in and out. Okay, reaching around the back here. Deep breath in and out. And one more time, deep breath in and out. Okay. Good job. Take your temperature here. Okay. And just checking your heart rate here. When was the last time you had your blood pressure taken? Okay. Well, we won't take it right now just because I don't want to stress you out any further. Especially if you were having good readings yesterday, then assuming you've eaten and drunk well. Yeah. Good. How's your sleep been since? It can be affected, yeah. Let me just write down. Just write down evidence of your temp. And you've not been run down with anything, no? Okay, so we're going to begin by first testing the overall sensation of your face. So we're going to be using a sharp tool, okay? I have this little pointer stick right here. And I'm just going to ask you to close your eyes, and what I want you to do is tell me when you can feel the sensation, okay? So for demonstration, this is the sensation, okay? And you could feel that, yes. Good. Okay. Close your eyes for me. Okay. Good. Okay. Good. 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 Okay. Good. 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 Okay. Good. Yes. Good job. Okay. Okay. I'm going to be taking a slightly different tool now. Okay. I'm going to be using this soft sponge here. I'm going to be doing the same again, where I'd like you to close your eyes and tell me when the sponge touches your face, but instead I want you to tell me where it touches your face, okay? Okay, so close your eyes for me. Good. Ready? Forehead, very good, okay. Good. 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 Very good. Okay, keeping those eyes nice and closed for me now. We're going to begin our first sharp and dull. Okay, so this is sharp, this is dull. Okay, just tell me which one you feel. Good. Which one was that? Dull, very good. How about now? That was dull, yes. Good. Dull, very good. Sharp, good. How about that one? Sharp, okay, good. Dull, good. Good. Very good. Okay. Next set of sharp versus dull. We have this little metal tool here, which feels like this. Good. And then we have this little cotton ball, which feels like this. Okay? Good. Keeping those eyes closed. Sharp or dull again. Very good. Dull, yes. Very good. Good. Okay. Dull, okay. Dull, good. Good. Sharp, good. Dull, very good. Okay. We are on to our last sharp or dull. We have, this one's a tricky one. This one is our sharp, so it is a lollipop stick. It feels like this. Okay. And our dull is the softer brush, softer silicone brush like this. Okay, so we have sharp and dull. Okay, close your eyes again. Ready? Dull, very good. 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 Very good. Okay. That is the end of our sharp versus dull test. I'm going to do a little bit of symmetry with you, okay? So I'm going to be gently tracing around the face. If at any time sensation disappears on one side or does not feel symmetrical anymore, please let me know. Okay? Okay, good. Good. Noticing any difference? I'm going to do symmetry again, but this time I'm just going to place a finger on either side. I want you to tell me if they feel the same, okay? Okay, so close those eyes. Good. Okay, good. Mm-hmm. Good. Okay. Good. 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 Mm-hmm. Good job. Okay. We're now going to be testing scratchy or soft. So I have this one brush here, which you can see is quite a dense, coarse bristle brush. Okay, so this is scratchy. Then we have a soft silicone bristle brush. So we have scratchy, soft. Okay, so this is scratchy. Good. This is soft. Okay. Ready? Good. Hmm. Good. Mm-hmm. Good. Mm-hmm. Good. Great, you can open your eyes now. We'll be moving on to your hands, so placing your palms nice and flat outwards. I'm going to be brushing your hands, okay, and I want you to tell me which you can feel, whether it's scratchy or soft, okay? Close your eyes again. Ready? Very good. Okay. Mm-hmm. Good. Good job. Mm-hmm. Good. Good. Mm. Good. Mm-hmm. Good. Good job. Okay, keeping those hands out. I'm going to be just using a soft brush now. I want you to keep your hands out. I'm going to ask you if you can feel it on your left or on your right, okay? You ready? Good. Right, very good. Mm-hmm. Good. Good. Left, good. Mm-hmm. Okay, very good. Keeping the hands out again. We're going to be now testing sharp versus smooth. So I'm going to place a ball into your hands, and I want, when you can feel the ball, to grasp it and tell me if you can feel that it's spiky or smooth. Okay, so keeping those eyes closed. Are you ready? Very good. Okay, next one. Mm-hmm. Good. Keeping a nice tight grip on those. Good. Mm-hmm. Good. Okay. Good job. And now finally we're going to be assessing hot and cold. Okay. So for hot, I'm going to be using the back of my hand here. You can feel, feels hot or warm. Okay. And then for cold, we're going to be using the back of this thermometer here. Yes, good. Okay, so closing those eyes again. Ready? Mm-hmm. Good. Mm-hmm. Good. Mm-hmm. Good. Mm-hmm. Good. Mm-hmm. Good. Okay, good job. Let me make some reference notes for your GP. I can tell that there is a slight hesitation towards hot and cold on your left side. I think that potentially your heat perception is not as strong. But in terms of actual physical sensation, you were able to differentiate strongly between sharp and dull. We didn't have any miscommunication on that. Same with the hands as well. There doesn't seem to be any loss of sensation at all. Your symmetry seems perfect as well. So I do think it is just a hot and cold sensation. This is not something that we would generally be concerned about. Naturally, as we age as well, tissue damage occurs, nerve damage occurs, we tend to get less receptive. Our nerves, don't work as well as they used to. But keep an eye on it. If you start to feel like you cannot feel heat or cold at all, then we would, do a little bit of digging in that sense. Do you have a health plan with your GP about the next steps? Yes, in regard to lifestyle changes, maybe medication after the a stroke? Okay, good. Okay, so what I'm going to do then is I'm going to get all of this info sent over to your GP. They're probably going to ring you to have a follow-up appointment just to go over what we've discussed today already. And other than that, it's probably likely that we shouldn't be seeing each other again. So in that case, I'd like to say a big thank you for being so patient today. I know that it can be quite a delicate subject, but you've done great. You've been such a good patient, thank you. And I wish you all the best for the future. Hopefully we don't have to meet again under these circumstances. Okay. Alright. Bye-bye. Make yourself nice and comfortable. Hi, how are you? My name's Dr. Michelle. I believe we haven't met before, have we? Are you new to the area? Oh, welcome. Have you so much for coming in at such short notice. Shall we check you in? Okay. Can I have your first and last name? Here you are. Just signing in to say that you arrived on time. Thank you. So I can see here that you're just here for a general checkup. You've been getting a little bit of eye strain and headaches. Okay. That's fine. So we're going to be performing a really simple eye examination today. Hopefully you should actually find it relatively relaxing. Okay? Some people have even said that they experience ASMR tingles from our eye examinations, so fingers crossed you do too. I'm going to pop some gloves on first because I'm just going to be touching around your eyes, okay? Great. So have you been experiencing any other medical issues, symptoms? Come down with any colds or flus recently? And other than your headaches and the eye strain, have you actually noticed any vision changes? So any blurriness, any partial loss of sight, any colour blindness? You haven't noticed anything? Okay. Alright, my lovely, just stay nice and still. I'm going to be pressing super gently around your eyes, just like this, okay? The wind's quite strong outside today, isn't it? I quite actually enjoy the gentle pitter patter of rain. So, are any of these places hurting as I'm pressing on your eyes here? No? And if I press on both sides like this, do they feel the same? And here? Close your lids for me. Does that feel the same? Okay, so none of that was painful at all. I'm just going to take my torch and have a little look in your eye, okay? So I'm first going to be looking for any styes. Let me just pull up your lid here. I'm going to be looking for any sort of styes, any scratches, cuts, abrasions, or any sort of like grit, sand in the eye, things like that. Would you describe any grittiness to your eyes? Okay, that's fine. You haven't had any sort of eye injuries at all? Nothing worth noting, no? No chemical burns or that may cause some strainage, but as you say, you've not noticed any difference in your actual sight, so that's really good. Okay. Okay, I think we're good. I'm going to test your pupil dilation next, so if you just want to look at the door, okay? Stay nice and still. Okay. Good. Okay, and the other eye. Okay, good. Did you experience any pain with the light? Did the light cause any discomfort? Okay. Let me just make a note. Do you work in any sort of environment where there's a lot of bright lights? What about screens, like computer screens, phone screens? And you wear glasses for that. How about glasses for driving? Okay. Just at night. So light does cause some sort of refraction. Yes, okay. That's fine. I'm assuming you've been previously diagnosed with astigmatism. Yes, yeah, that's usually why we would give people nighttime driving glasses. Okay. Let's keep going. I now have my ocular occluder here. Okay. And I'm going to use this to cover each eye one by one as we perform a few different tests. Okay. So let's start with covering this eye here. I'm just going to ask you with the other eye to keep your head nice and still and just follow my finger. Good. Good. Okay, switching over, following my finger with this eye now. Okay, and then with both eyes, keeping your head nice and still, following my finger. Good. Good. Good job. Okay, we're now going to do a periphery test. I'm going to be bringing my hands into your field of vision like so. And I want you to tell me when you can see them. Okay? Keeping your head nice and still and just looking at my nose, okay? Very good. Good. Good job. Okay, let's do that one more time. Good. Good. Amazing. Getting our occluder back out again. This time I'm going to be holding up my fingers and displaying different numbers, okay? I want you to simply tell me what numbers you see without looking at my hand, okay? So I'm going to cover one eye. With your other eye, I'd like you to focus on my nose or on the wall behind me. And I'm just going to show you some different numbers. Are you ready? Good. Yes. Good. Good. Yes. Good. Yes. Good. Good. Yes. Good. Good job. Okay, I'm switching over now. And again. Good. Yes. Good. Good. Good job. Good. Yes. Good. Good. Good job. Good. Well done. Okay, you can relax for a moment. So how did you find those tests? Yes. No eye strain during those? Okay. So I believe that it is due to light. But I'm going to do a quick colour test with you as well, just to identify that you don't have any colour issue. Okay. So your peripheral vision is fine as well. You can see clearly all around. You have no ocular points that are damaged, so that's really good to see. Your tracking is also really good, and your ability to pupil dilate is really good as well. So I'm just simply going to show you some different colours, and I want you to tell me what colour they are, okay? Okay, firstly, red. Very good. Next, gold. Next one. It's purple, very good. And again. Pink. Okay. Blue, very good. Black, good. Purple, good. Silver. One more. Bronze. Very good. Okay, so it seems as though you don't have any issue with colour blindness either. It seems as though the only thing that is irritating and causing eye strain currently is light. So although you are wearing glasses currently for nighttime driving, I would suggest stepping up the eye use wear and starting to wear those glasses whenever you are in any bright lit rooms. Things like hospitals, for example, have those very strong lights, don't they? Same again when using any sort of screens. I think it's best if you wear the glasses. You can also go into the settings of your devices and set it so that it takes away the blue light. That can sometimes help with eye strain. It also helps with sleep, so if that's something you've been struggling with, definitely recommend. Okay? Amazing. So, I'm going to send you on your way and ask you to wear your glasses more often. If you still don't see any sort of improvement, please both come back to me to book an appointment and maybe be referred to your GP over the migraines, okay? It's been a pleasure. Alright, take care. Bye-bye. How are you feeling? Okay, you're experiencing some chest pain. Okay. Thank you for coming and seeing us today. Let's see if we can get you feeling better, okay? Let's try and find you on our system. Can I have your first and last name? Mm-hmm. And your date of birth. I can't seem to find you on the system. Have you been to this particular hospital before? You've moved, okay. Where did you move from? Let's have a look. Just see if I can find. Could I just have your address? Mm-hmm. And your previous address. Ah, there we are. I can see you. Yeah, so I've transferred you over to your new address to this new hospital now. I can see the last time that you came in was 3 years ago, and it was also for chest pain again. How was that one resolved? Okay. Okay. I'm going to ask you a few medical questions before we begin the assessment, okay? So, are you aware of any family history of chest-related issues, heart disease, stroke? Okay. Are you currently on any medications? And have you been seeing yourself in the past 12 months for heart-related problems? Okay. Have you ever experienced blood clotting? Okay. Lifestyle-wise, have you been partaking in anything that would be of concern? So, do you partake in any sort of extreme sports? Anything that would get your heart rate to an unsafe level? Adrenaline-based activities, yeah. Okay. How about your caffeine intake? 2 coffees a day average. Okay, and is there anything else that I should be made aware of? Otherwise, how are you feeling generally in yourself? Have you noticed a dip in your energy? Any muscle weakness at all? Any brain fog? Headaches? Blurry vision? Okay, well, we'll have a look at all of that. I'm just going to take your blood pressure first, and then we'll get you set up to the EKG machine, okay? That's going to listen to your heart. Okay. Let me just pop on some gloves. Blood pressure taken. So you could just roll up your sleeve. Just roll this around your neck. Okay. Ready? Just try to relax. Here. Right. So we're currently sitting at 110/70. Ever so slightly low, but do you commonly have a little bit lower blood pressure? Yeah? Okay. We do not concern currently for high blood pressure, so low is not too much of a concern, and like you said, you feel fine in yourself, you don't feel dizzy. That's fine. Okay, let me just take your pulse here. Okay, just put this on your finger. Okay, nice and normal. Right, I'm going to set you up to the EKG machine now. I'm just going to get the electrodes, okay? You'd just like to try to, go expose your chest for me. I'm just going to be using this electrode gel. This is just going to keep your skin nice and safe, okay? Alright, I'm just going to spread this. Does that feel okay? Okay, let's get these electrodes on. This one. There we go. Okay, let's just get you hooked up with these wires here. Okay, you're nice and comfortable. Good. Could we just remove the watch for me? And do you have any other jewellery on? Any smart watches, smart devices? Okay, just take your phone out your pocket. Alright, let me just get this machine started and we'll just monitor it for the next 20 minutes or so, okay? Just so we can get a good reading. So did you have an EKG last time? And what were the results like? Okay, well that's positive to hear. Right, okay, so whilst we wait for that to happen, I'm just going to be running a few different tests on you. I'm first going to be checking pulse pressure points around your body just to check that they are all symmetrical and that blood flow is consistent. Okay, so just checking the neck first. I'm just going to be pressing on the inner elbow and the wrist of each arm, so let's do this arm first. Okay, on this side. Okay, and on this side. Okay, each elbow. Okay, and wrist. Good. I'm just going to be checking behind your knee, okay? Okay, other side. Okay, while I'm down here now, I'm just going to be checking for any swelling, okay? Any indicators of edema. Just going to be doing some palpating as well. You don't feel any sort of differencing with swelling at all? Okay, not been on a flight recently? Okay, I'm gonna have a listen to your chest now, alright? Okay, start at the front here. Reaching around your back here. I'm going to be palpating again, this time on your chest and your back, okay? Let me know if you're feeling any pain or if anything changes at all, okay? Around the back, okay? all fine there. Can I physically just have a little bit of a look at your chest? Do you have any allergies at all? I can see it's almost like you've got a little bit of a rash. Have you noticed that? And you said any other symptoms, you feel completely fine. Okay, I'm just going to make a little note. I just want to check your overall health whilst we're finishing off. Yeah, just because I'm just a little bit concerned that maybe you've got something viral that's affecting the chest pain. Couldn't hear anything on your chest specifically. In fact, before we move on, I'm just going to have a little listen to your lungs this time, alright? I'm going to check that your breathing is normal and okay. Okay. So could you just take a deep breath in? Good, and out. Okay, and again in. Out. In. Out. Okay, round the back. In and out. In and out. In and out. Okay. Do you hear a little bit of rattly breathing? Just want to have a little look in your eyes now, okay? If you could just look behind me. Good. Mm-hmm. Okay. Okay. If you could just keep your head nice and still, just follow my finger here. Just follow my finger, good. eyesight. Your eyes don't feel tired at all. Maybe a little bit. Okay. And again, you said no problems with your vision. Okay. Let's have a look inside your throat. If you could just open that for me. Say ah. Ah, good. Okay, and in your ears. Here. Good. Okay, let's see. Okay. They all seem absolutely fine. Has your chest pain been coming and going, or has it been constant? And has the pain been like a steady pain, or has it been increasing? Okay. How would you describe the pain? Would it be a sharp, stabbing feeling, dull and achy? Does it feel like a warm feeling? Okay. So almost like a pulling, tugging sort of sensation. Alright, let's get this EKG monitor turned off. I'm just going to remove these electrodes. Feeling okay? Your skin's not too sore? They're good, these ones. They don't stick too hard, so it rips any hair off. Okay. So let's just print off the reading. Okay, so as far as I can see, your reading's completely normal. I just want to test a little bit of movement with you. I just want to test a little bit of movement with you before you go. I have a feeling that you may have pulled some sort of muscle within your chest cavity area, which is causing that pulling, tugging sensation. So I'm just going to be doing some small exercises with your arms, okay? Alright, so I'm going to place my hand on your chest here just to steady you. I'm going to pick this arm up first, and I'm just going to slowly lift it up towards your head. Just tell me if you're experiencing any pain. Yeah, okay. Bringing that slowly back down, and I'm going to now bring it out wide. That's really painful. Okay, bring it across your body here as well. Painful again. Okay, let's leave that arm for now. Let's give your other arm a try, okay? So steadying on your chest here. Alright, I'm going to lift your arm up, 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 up. Okay. Painful again. Okay, slowly bringing back down. And now wide. Painful again. Okay. Then across. I'm just going to gently rub the chest area. I want you to tell me if there's any muscular tissue pain, okay? Yeah. Okay, keep going. Let me know if it's too much. That's really painful there. Okay. Do you do any sort of physical activity, any sports that you take part of? Do you go to the gym? Okay. So I think what's likely happened here is I think that you've probably pulled a muscle, rare as it is to pull a muscle in your chest. I think it's probably due to the weightlifting. You've not experienced it for a long time. Okay. So I think it's probably muscular strain. And because of where it's located, you're feeling it in your heart, you're feeling it in your chest, but I think it's actually the external muscle, which is a good thing. What I'm going to ask you to do is I'm going to ask you to take at least 2 weeks off of training, okay? Rest up, and I mean really rest up. Don't be trying to do any form of exercise during that time. Just light walking, very, very light stretching, okay? Dose up on paracetamol and ibuprofen to manage the pain. If it's not getting better by this time next week, you don't feel any sort of marked improvement, then please do get back in contact with us. But just keep an eye on that blood pressure. Do you have a blood pressure monitor at home? You do. So what if you could take your blood pressure morning and night for me? Just keep an eye on it, and if the pain is getting any worse, moves on to more of a stabbing pain rather than a sort of pulling, tugging pain, please call 999 straight away, come back to us and we'll get you checked out again, okay? Alright, for now you can go though. Otherwise I think that you are fine. I would just say take it easy, you know? I know that we can get a little bit competitive in the gym, but pace yourself, okay? Alright, well, it's been a pleasure meeting you. Alright, look after yourself. Hello. Welcome to the sleep clinic. We've had you here before, haven't we? A long time ago, that's right. So you've still had no luck with regards to your sleep. That is a shame to hear. Well, you're booked in for 2 evenings, and we will try our absolute best to assist assist you in figuring out what it is that's going wrong. Alright. Oh, my lovely, it's okay. I know. I know how stressful it can be. It's a struggle with sleep. Okay. Well, I'm going to take a little bit of info first, and then we're going to get you prepped, okay? Okay. I also, if you don't mind, I'm wanting to do a little bit of a health check, just a small one, just so I can make sure that you're definitely in tip-top shape and nice and healthy, okay? Alright, my lovely. So let's just write down your info on this form. So first and last name, please. Okay, and your date of birth. Thank you. Okay, so when was it that you first had these sleep problems? So it's been quite a long time. Okay, and have they progressively gotten worse, or have they been consistent? Progressively worse. Bless you. Okay. Is there any way that you can combat them? Have you tried sleeping pills, earplugs, eye masks, ASMR, meditations? None of those have helped. Okay. Okay. And how would you categorize your sleep issue? Would you say it's predominantly insomnia, night terrors, sleepwalking? Yeah, I've suffered with insomnia for years, so I definitely sympathise. It can be quite painful, can't it? Yeah, because it does take a few days to recover. Do you find that? Bless you. Yeah. So this really has been an ongoing problem for years. Have you found at any time things have gotten a bit better? Okay. Okay, and how would you categorise your overall lifestyle? Do you spend a lot of time sort of sitting down at the computer, or are you quite active? Okay, do you sleep on your own or with your partner? Okay. Alright, so my lovely, what we'll do is we'll do a few different health tests, just simple ones, to make sure you're nice and healthy before we submit you into one of the treatment rooms, okay? So, and then just make sure that you're nice and responsive still, okay? So lift up your chin up for me. Just have a little listen to your heart first. Are you experiencing any other health issues at the moment? Okay. Alright, I'm going to have a listen to your lungs. Stay still. Just breathe normally for me for a minute. Alright, and if you could take a deep breath in for me. Good. Okay, and then deep breath out. And again, deep breath in for me. And then out. Okay. Just coming around the back. Okay, deep breath in again for me. great. Well done. That's great. Alright, that's great. I don't see any problems there at all. Okay, let's take your blood pressure now. Okay. So if you could just lift up your sleeve. I'm just going to put this on your arm. Is that comfortable? It should be a little bit tight, but not too much. Okay. Okay, let's remove that. Okay, I'm all happy with that. Just wanted to make a note of those so we have them on file. So then if anything does change over your stay, we can monitor it. Have you ever experienced high blood pressure before? No? Okay. That's fine. Okie dokie. So I have this little pulse oximeter here. And I'm just going to pop this on your finger like this. Press this button. And it's going to take your BPM in a few seconds. Okay. Just relax. Pop that in there. Doesn't hurt or anything. Okay. And we'll just give it a few seconds. Okay, so we've got blood oxygen of 96 and BPM currently of 82. Oh, you're a little bit nervous. Oh, bless you. It's okay. I know that you are obviously in a lot of discomfort, pain, stress, but there is absolutely nothing to worry about. We'll make sure to take very good care of you. We've got a big team of wonderful doctors here that will take really good care of you, I promise. Okay. If at any time as well there's any sort of food, snacks, drinks, anything that you want, we'll go and get that for you. Okay. But of course we need to monitor you from evening to evening and then the morning. So you will be spending the full day with us tomorrow. I hope that's okay. We'll have plenty to keep you busy. Alright. Great. What we usually actually do is we will put on a lot of sort of mental, physical activities for you so that you're very stimulated through the day, so that we know that you've been very active, burnt a lot of calories, moved around, used your body efficiently, so that we know that you should be efficiently tired, so the insomnia is coming from the problem and not just you being lazy. Yeah. Okay, so, wait, let's finish the examination and then I'm gonna prep a little bit and pop some electrodes on you, okay? Alright. So, I just want to have a little look in your eyes, if you don't mind. Just because I want to check your responsiveness, make sure that you are dilating correctly, you can follow fingers, because of course insomnia can affect brain capacity and function, okay? So you just stay completely still, look at my nose or the wall behind me. I've got this little torch and I'm just going to be shining it in your eyes, okay? Don't look at the torch and just try and relax, okay? pupil dilation here. You're doing a really great job. Okay. Sorry about that. I know it can be a bit uncomfortable to have the light shining in your eyes. Alright, I just want to check your responsiveness, okay? So I'm going to ask you now to follow my finger. So keeping your head nice and still and just using your eyes, alright? Going in and out. Okay, I'm happy with that. Do you wear glasses or contacts at all? Okay. Okie dokie. Right, so I'm happy with my assessment now. Again, just to preface, you don't have any ongoing illnesses at the moment, and you're not on any medication. Okay, great. Can I ask what you've been up to today? Sounds lovely. Okay. So hopefully you'll get a really nice, good night's sleep tonight. Okay. So, I'm gonna give you a candle to put into the room. You can choose whether or not you'd like it. Let me just go and grab it for you. It's just a little extra, just in case you wanted some sort of relaxing scent and atmosphere in the room. This is ginger and white pomelo. Yes, of course, right. I will light this up for you then. There we are. You should start to smell it now. Okay, so I'm going to pop that in the corner of the room, and completely up to you, but I can give you a little bit of relaxation before. I can just do a little bit of skincare on you. Yeah, of course. We'll just give your face a cleanse and moisturise. It'll make you feel nice and calm before bed. Okay. Okay. So let me pop these down here. So I'm just going to take this cotton bud and a little bit of cleanser. cleanse your skin. Using all lavender scented products as well today, which just helps boost the relaxation. Okay. And then I'm going to be taking this Mineral 89 by Vichy. This is purifying, fortifying and plumping daily booster. This is really hydrating. Wake up in the morning with really nice hydrated skin. Okay. So, we're all done. I'm now going to pop the electrodes on you, okay? We're going to be needing quite a few. And then when you go into your sleep room, we'll be plugging you in with wires, okay? And you've been through this all before. Okay. Start with the first pack. Pop this one here. This one here. Do one on your forehead here. And then the other side of your forehead here. Do a few behind your ears. Maybe just grab a fresh pack. in this ear loop. This one. Okay. And then we'll just do 2 more on your temples here. And these will just measure brainwave activity. Okay, final one. There we go. Alright. Is that comfortable? I know it can feel a little almost like you're in space. A bit sci-fi. Alright, well if you're all comfy and ready, I'm going to escort you to the sleep room now. That will be your room for the duration of your stay, okay? What we'll do is we'll get you wired up, and then we're going to leave a nice ASMR relaxation music and track for you, okay? Alright.